push them and keep my picture on and listen. But when I arrive home, I'll be home about 10 minutes.
Abby, are you able to mute everyone?
Yeah.
Yes.
Good evening.
We're live whenever you'd like to begin.
I see. I was muted also. That's okay. We are live. We are ready to go. Welcome to the state delegation's public hearing for recent local bills and statewide issues. I would like to welcome everyone to the hearing. I'm Delegate Courtney Watson, the House Chair of the Howard County delegation. I would like the other legislators here to introduce yourself briefly, starting with Delegate Kittleman.
Thank you. I am Trent Kittleman, and I represent District 9A, which at the moment has Western Howard and Southern Carroll County.
Delegate Hill.
Good evening, everyone. I'm Terry Hill. I represent District 12 with a fantastic team, and we represent Howard County and Southwest Baltimore County.
Delegate Terraza. Oh, sorry.
Health and Government Operations Committee. Thank you.
Thank you. Sorry. Delegate Terraza.
Hi, I'm Delegate Terasa, and I represent District 13 along with Senator Guy Gazzoni, Delegates Shane Pendergrass, and Vanessa Atterbury. And I think that was this. I serve on the Environment and Transportation Committee. Oh, I see Senator Gazzoni's here. So
Senator Gazzoni.
Himself.
Hi, everybody. Senator Guy Gazzoni, District 13, the chair of the Senate Budget Committee.
Delegate Novotny.
Hello, everyone. Delegate Reed Novotny, District 9A, Western Howard County and Southern Carroll County.
Delegate Ebersole.
Hello, everyone. This is Delegate Ebersole, also representing District 12. My camera's off because I'm caught in a little traffic as soon as I get home. You'll have my face.
Okay, that was Delegate Ebersole. He represents District 12 at the moment. A little bit hard to hear, but he will be jumping on at home momentarily. Just want to go over the rules of the road very quickly. And as a reminder, we're being recorded and live streamed to the public. Please keep your microphone muted until it's your turn to speak. And if you have signed up, you may testify for up to 3 minutes. An alarm will ring in the form of Ms. Rubeling, who will tell you when your time has expired. We cannot put a time clock on the screen because we are unable to, when we do that, that's all the people who are watching on live stream will see. So we will not have the clock up, but you will be notified when your 3 minutes have expired. It might be helpful to keep time on your own device. Request to minimize wasted time between individual testimony. We would greatly appreciate it if you would please respect the 3-minute time limit to ensure that we can accommodate as many people as possible in a reasonable amount of time. I'm going to announce 3 names next up to testify so you can be prepared. Please only unmute your microphone when it is your turn to testify to minimize background noise. We will go through the local bills that were not heard in November, followed by legislative bond initiative requests, and then move on to statewide issues. We'd ask that you adhere to the established rules regarding testimony. All bills and bonds that were heard at the local bill hearing in November will not be discussed tonight. The only Howard County local bills and bonds that will be discussed are listed on the agenda. Any statewide bill before the Maryland General Assembly this session is eligible for discussion. When you're up to testify, please state your full name for the record. And up first, we have Council Member and Liquor Board Chair David Youngman, followed by Mark Baxter, followed by Francis Yu.
While they're coming, Madam Chair, Delegate.
Chief Reed.
David Youngman, I can see you and I can see you're not muted.
I'm sorry, Chair Watson. I thought you froze for a second. Not froze in real life, but froze on the video. Do you want to do one bill at a time?
No, I just think you need to
Want me to set them
review
up?
14, 15, 16, yeah, all together.
Okay. Okay, I'll do them all at the same time. Can you still hear me?
Yes.
Okay, good, because I, switched apps and you never know how these things work. So, HOCO 1422 is to remove the requirement for newspaper advertising for hearings and new licenses, et cetera. The reason for the bill is, frankly, newspaper advertising has gotten super expensive, and a lot of applicants and petitioners have asked that we eliminate this requirement. It's becoming more and more antiquated. We do still advertise all the hearings on our website, but more importantly, they get advertised by posting the property. So anybody that is close by that is interested in whatever changes might be happening with that liquor license can see that big yellow sign with all the pertinent information about the public hearing, et cetera. HOCO Bill 1522 removes a provision that is called so if you're applying for a liquor license, you need to get 3 residents that are owners of real property in the same district that your application, your business is going to be in, to sign an application. It dates back to the days of them being sort of your character witnesses. But now the Alcohol Beverage Hearing Board and the Liquor Board do formal background checks, pull witnesses into hearings, et cetera. And it's gotten to the point where, because a lot of licensees, especially in the chains, don't know anybody in the district, they're just finding 3 people to sign a piece of paper. The real work on determining if you're fit and proper for a liquor license is done in other ways now. And finally, HOCO 1622 changes the resident agent requirement. Right now, the resident agent is required to be a member or a resident of Howard County. Some jurisdictions have gotten rid of this residency requirement altogether. We're not comfortable with that, but our liquor inspector, who, when there's an infraction, needs to reach out and find a human being, and our hearing board are comfortable with expanding that to be a resident of the state of Maryland, not necessarily of the specific of Howard County. So that is the summary of our 3 bills.
Great. Thank you for that testimony. And following you, we have Mark Baxter, who's the Howard County Police Department Liquor Inspector. Is Mr. Baxter here? I'm not sure he is here. If he comes in, we'll let him testify later, but we'll move on at this point to Francis. Is Francis here? I'm not saying his last name because I cannot pronounce it. I don't see him. Miss Rubeling, can you tell if either of these people are here?
I don't see them.
Okay, Chow Wu.
I don't see them either.
I thought they had a Board of Education meeting tonight, so I don't know that he would be here. I bet we have Brent Loveless with us tonight.
Good evening. Thank you.
Good evening.
And you are correct. There is a Board of Ed meeting, and they are discussing, of all things, legislative positions as we speak. So I'm sure you will get a delayed update from them, but that's not why I'm here. I'm here to speak specifically about State Bill 0756. It is now titled University System of Maryland County School Technology Pilot Program Established. It effectively is an effort we've been looking forward to for many years, and hopefully it proceeds from the Senate to the House and onward to approval. It effectively attempts to use the state of Maryland's university system, academia, technology to assist our Office of School Planning and the Howard County Public School System in predictive analysis, trends, and data mining and resources in order for them to do a much more effective job of redistricting, as well as school planning, as well as budgeting. Not only is this a benefit to Howard County, the lessons learned from these very, very skilled professionals are intended to be reported back to all the other local jurisdictions so that they can both share in any technologies developed and take advantage of any efficiencies gained as a benefit. And thank you all who have come out to the PTA Council meetings where we discuss this. And I saw a lot of support from many of you on this topic. So I hope it continues to proceed. And I hope this is a win-win to find efficiencies for our kids, make sure that egregious items are kept to a minimum, and lessen the impact of moves with better future planning, and help with our budgeting and predicting. I could go on, but I only have 3 minutes. You may also know that the state PTA has been under a lot of pressure from a break-off group, and they may not have the resources to legislate the best at the state level this particular year. But in general, the PTA Council supports the legislative initiatives of the state PTA, the Free State PTA, as they are known currently, and hope that we support them in education as well. Thank you very much for listening to me tonight, and we wish you well.
Thank you, Mr. Loveless. It's always a pleasure to see you at these hearings over the years. And now we move on to Joel Hurewitz. Mr. Hurewitz, are you here?
I am here.
Okay.
Find everything.
Mr. Hurewitz, if you're speaking, we cannot hear you.
Now I was trying to get organized. Sorry.
Okay.
All right. Good evening, members of the delegation. I'm Joel Hurewitz. I live in Columbia. First, I'd like to say opposition to Delegate Novotny's HB 314, dealing with recall and even number of school board members. I find them two of the ill-conceived bills with practical and mathematical issues in both bills, and the sponsor today could not coherently explain how the school board bill would work. I support your work with the Aviation Commission and the Patuxent River Commission with the Patuxent River Keeper member. HB 157 is Senator Lamb's old plug-in electric bill that I spoke to you several years ago about. Last year, General Assembly, I got them to fix the definitional problem that I've been dealing with, as Delegate Truss is well aware of. That bill died on sine die in the Senate, so I hope that we'll proceed and we can then fix the Howard County definition. Delegate ebersole, student board member, I wasn't sure why it was only restricted to the budget issues and not to the boundary adjustments, which I think is what the student board member has most knowledge of, and I think they should weigh in on that. And lastly, what to deal with Delegate Truss is HB 93, dealing with the disclosure, and particularly in the Columbia election system. As she and others are aware, I support the concept of disclosure, but I really do not like this bill. It has definitional and structural problems. It's impractical. It will chill voters and a burden on reporting. There are numerous definitional conflicts with the election code that doesn't even make it clear that it even will apply. It makes other sections of the election code that might apply and bring in civil and criminal penalties where they're not intended. Again, giving a burden on candidates running. More importantly, It seems that it won't even apply to 4 or 5 of the villages because they do not have 2,000 units. They have members, they do not have units. And also any legislation that does not deal with independent expenditures in a practical way will be ineffective. And I watched the subcommittee hearing yesterday. Ways and Means is not the right committee, I believe, to deal with the HOA issues. And I would hope that we're going to separate the municipalities and the HOA, particularly Delegate Belmark, that E&T would be the appropriate place to deal with these really complicated issues of the homeowners law. So, thank you.
Thank you, Mr. Hurewitz. We have Mr. Baxter here, and I would like to ask him if he has testimony to add to Mr. Youngman's testimony about Council Bill 14, 15, and 16. If you're trying to talk to us, you are muted. Ms. Rubeling, can you help us?
I don't think that I can.
Sorry. Oh, there we go.
Here we go.
Hear me now?
Yes.
No, I do not have anything to add to Mr. Youngman's testimony.
Okay. Well, thank you for being here in case we had questions, and we will likely be in touch before the next work session, which is next Wednesday.
Okay, great.
All right. And we're moving on now to John Pica with testifying for the Living in Recovery LBI.
Thank you, Madam Chair. I'm joined, and I'll be very brief. I'll turn this over to individuals who run Living in Recovery. This is a bond bill. We want to thank you, the House sponsor, and Senator Hester. Also want to thank Senator Gazzoni for a bond bill that Living in Recovery has received in 2 years ago, or 2019. Living in Recovery provides transition housing for individuals who are leaving rehab and don't have a place to live. They have a capacity of 18 beds right now, or 18 individuals. This bond bill will help them double that capacity. They lease 2 homes and own a home in Howard County. And the house that they hope to acquire will also be in Howard County. So with your permission, Madam Chair, I would like to turn it over to Mr. John Amato and Mr. Roger Huff, if that's okay with you.
Okay, we have Roger Huff next on our list. Does he want to testify first, or does John Amato?
I could certainly go. This is
Okay.
Roger.
Please go ahead, Mr. Huff.
Thank you again for allowing us to come forward and present our need for resources for Howard County residents that are entering a sustainable recovery process. And just to highlight some of the accomplishments that's happened with some of the generous funding that's happened so far is, you know, we were 0 positive cases for COVID because we were able to social distance and keep our residents safe. We did not have 1 discharge as a result of financial instability over the last 18 months as a result of folks not being able to work. So we really pride ourselves in the ability to be able to really maintain a safe, structured living environment and help people reclaim some dignity as they're emerging. And some of our population are very vulnerable, men and women, coming out of detention centers, coming out of grassroots crisis beds. We're able to work with the state, with the Behavioral Health Association as well, and get people generally 2 months of funding while they look for work. We also have a pilot initiative we started this year with a dental practice, allowing people again to reclaim some dignity by having some dental work done with them to help them start to move forward. So the funds that are presented and are distributed to Living in Recovery go for more than just expansion and renovation. It helps with peer recovery support specialists. It helps with rent. We're able to provide safe, affordable housing through this pandemic. As I said, we had 0 positive cases. We had temperature, masks. So very, very grateful to be able to come before you and let you know what we've been doing.
Thank you, Mr. Huff. And now we'll hear from John Amato. on the same topic?
Yes, good evening, everybody. As Roger said, we appreciate the opportunity to come and speak to you tonight. I don't have a whole lot to add. Living in Recovery was founded 11 years ago. So we've been operating as a 501c3 in Howard County as a certified recovery residence. And, about 40% of our funding comes from rent from individuals that are coming through us and spending time in our houses trying to get their lives back together. The rest of our budget is supported through private and donations, as well as some of the grant funding that we've been fortunate to receive over the years. And so we appreciate the opportunity. We really strive to help people get their lives back together and establish the tools to help them remain in long-term recovery. Since our inception, we've served over 400 individuals. We've had a track record of maintaining 65 to 70% of the individuals that come to us remain clean and sober during their time with LIR. So those are just kind of key metrics for us. But again, I think Roger really addressed, the need and what we're looking to do. We just believe that this is an underserved community. There are many more folks out there that need our help that aren't able to get it. And we'd like to be able to support them.
Thank you very much. Next on our agenda, we have Lynn Locke, who will testify about Historic Oakland Elevator, LBI.
Yes, good evening, everyone. Thank you, Madam Chair, and thank you, delegates and those viewing. It's a great opportunity to speak about Historic Oakland Manor, one of Howard County's oldest buildings, built in 1811. My name is Lynn Locke. I'm the village manager for Columbia Town Center, one of Columbia's 10 villages, and the executive director for the Columbia Town Center Community Association. Our board is requesting a grant from the state of Maryland to install an elevator in Historic Oakland at 5430 Vantage Point Road. The building's second floor is not accessible to the mobility challenged and prevents those with ADA issues and other mobility issues from getting to the second floor and attending community events, craft shows, weddings, celebrations of life, and other important Howard County events such as Kwanzaa and Juneteenth that many delegates on this call attended last year. More than 400 events at Historic Oakland are held each year in a normal non-COVID year, and we're not able to accommodate those that are mobility challenged. The installation of the elevator will help those in the community, the county, and the state, because we do have events that attract people from all over the region. And it will help us to give access to all levels of a historic building. In 1688, when John Dorsey surveyed the land around Historic Oakland, he built a small stone house on the property. Then in 1811, after changes in ownership of the land, then Speaker of the House of Delegates, Charles Sterrett Ridgely, constructed Historic Oakland. Over the years, it has been the home to the Rouse Company, who founded the city of Columbia, and the county offices for the American Red Cross. The Columbia Association is now the proud owner of this historic asset in the center of the activity for the village, now called Town Center. When Jim Rouse was planning Columbia, he took particular care to preserve Columbia's historic buildings such as Dorsey Manor, the barn at Oakland Mills, and what we are presenting tonight, Historic Oakland. So I would respectfully ask that you consider our request for the grant to install the elevator. It will assist those that are mobility challenged to have access to all floors of the manor. Each group and organization that has events at Historic Oakland has individuals that are mobility challenged, and the layout of the building prevents them from accessing the second floor historic ballroom. In addition, we are not able to offer the full facility to groups and organizations whose members are 100% mobility challenged, and we do get those requests during the year. So your approval of this request will give access to everyone so that everyone can enjoy one of Howard County's most historic and cherished assets. Thank you for considering our request.
Thank you. Thank you very much, Mr. Locke. I will now turn it over to the Senate co-chair of the Howard County delegation, who I would ask to introduce himself since he was on late, and then ask that Delegate Pendergrass, who's also here, be given a chance to introduce herself before we move to the next person.
Sure. Thank you, Chairperson Watson. So I'm Clarence Lamb, Senator in District 12, the current Senate co-chair of the delegation. Apologize for being late. We had a late voting session in our Senate Committee, Education, Health, Environmental Affairs that we just got out of, and Senator Hester is still on her way towards making it onto this meeting, this hearing. So, and let me turn it over to Delegate Pendergrass to introduce herself. I think you're still muted, Delegate Pendergrass.
How about that?
There we go. Go ahead.
Excellent. Nice to see everybody. Sorry to be late. My meeting ran late, but it's wonderful to be here and listen to what people have to say, which is what we're here for.
Also looks like Delegate Feldmark might not have had a chance to introduce herself too. So Delegate Feldmark, go ahead.
Thank you, Mr. Chair. Good evening, everyone. I'm Delegate Jessica Feldmark, represent District 12, serve on the Ways and Means Committee, and I'm very happy to be here to hear from community members.
Okay. So I think all members have been introduced up to this point that are in attendance. So we're going to proceed with the rest of the members of the public that are here to testify. Next on the docket, we have Ms. Dianebutler. You have here listed that you would like to speak on workers' compensation issues. The delegation is accepting oral testimony on specific bills. Is there a specific bill that you would like to discuss, to testify on tonight?
They said that we could talk about any state issues. It said bills and any state issues. And this is a really important state issue. Okay. Why don't you go ahead and just be mindful of the time limit. Okay. All right. Thank you. My husband was hit in the head at work with part of an 85-pound pallet that broke apart and snapped back, hitting him in the head hard enough to rupture the retinas in both of his eyes. He has a traumatic brain injury and post-concussive syndrome. He's not getting the treatment that he needs, and this is very dangerous for him. Maryland workers' compensation is broken. I want it fixed, and you are my legislators, and I want you to fix it. Most of you know me and my husband, the hardest working gentle giant that you will ever meet. My husband went from supporting his family, working 60 hours a week, to a man who cannot walk in a straight line, cannot drive a car, cannot work, cannot stand up without falling on a regular basis, and workers' comp is failing him. Workers' comp is supposed to oversee the process of the employer's insurance company to make sure that they replace my husband's wages and to provide him with medical treatment for the injuries he suffered on the job due to dangerous working conditions and to get him back to work. Workers' comp is supposed to make sure that the unsafe working conditions are corrected so that no one else gets injured, and to make sure that the employer's insurance company is held liable for these costs instead of the taxpayers, you and me, in the form of Medicare and Social Security disability. None of this is happening. My husband is not getting workers' comp payments. He's not getting proper medical treatment. He has not been given a functional capacity evaluation to see what other work he might be able to do after being terminated from his job while out on workers' comp because it's too dangerous for him to work there in his condition. Do you know how dangerous it is for him to not get treatment for his brain trauma? I do. So I am paying for it out of my pocket and will probably end up losing my house here in Howard County. What is my husband supposed to do if he's not allowed to go back to his job, not allowed to be evaluated to do other work, not allowed to collect his benefits that he paid into for 42 years, and not allowed to be treated for the work injuries? Is he supposed to just lay down and die? Workers' compensation is supposed to compensate and protect the injured worker, not the insurance company for the $28 billion corporation that has yet to fix the dangerous working conditions that cause this injury. I am shocked at how broken this system is. I'm shocked that everyone keeps telling me how broken this system is, yet no one's doing anything about it. No MMI hearing should ever be held without advance notice to the injured worker so that they can get all their treating doctor's notes and recommended treatment plans up to date and ready to present to the commissioners. Commissioners should never make medical decisions. They are not neurologists. And any MMI hearings that were held during COVID need to be re-held in an entirely different setting than the one used immediately. Maryland workers' comp is failing injured workers, and I want you, my legislators, to fix it. Insurance companies are waiting a full year to provide treatment, and waiting 2 years and 3 months for a medical hearing appeal is criminal. Plus, the commissioners need retraining as to just who they are paid to serve. Thank you very much, and hi to everyone that I know.
All right, thank you, Ms. Butler. Next, we have Ms. Janet Edelman here to talk about outpatient treatment, assisted outpatient treatment. Ms. Edelman, go ahead. You are muted. Good to see you again. There you go.
There. Good evening. My name is Janet Edelman. I live in Columbia. I'm currently chair of the Howard County Behavioral Health Advisory Board, but I'm testifying as an individual. Please support Senate Bill 807 and House Bill 1017 to authorize the establishment of an evidence-based assisted outpatient treatment pilot program, AOT, in Maryland to serve those with severe mental illnesses such as schizophrenia and bipolar disorder, who are unable because of their illness to engage in voluntary outpatient services. In 1999, both Maryland and New York studied the issue of AOT, also sometimes called outpatient civil commitment, OCC, to provide support for people living with a mental illness that do not engage voluntarily in treatment. New York moved forward with the program at that time and now is a model for the country. Maryland chose not to proceed and is basically in the same place as it was in 1999 on this issue, since the Baltimore OCC pilot started in 2017 has tragically failed its target population. One of the main intents of the Baltimore pilot OCC enabling legislation was to, quote, inform effective planning to implement community services that better serve state residents living with a serious mental illness who do not engage voluntarily in treatment, close quote. Only 3 people were reported as involuntarily enrolled in the Baltimore pilot in fiscal year 18, and none reported after that. The Baltimore pilot was originally funded by a SAMHSA AOT grant, but the grant was terminated early since the pilot failed to meet the required minimum of 75 involuntary patients and failed to meet AOT evidence-based standards. For example, the criterion for eligibility is set so very few people who could benefit from the program actually qualify. The OCC court order does not specify a treatment plan to be followed. The Baltimore pilot has not presented hard data on outcomes. It failed to show that it can routinely provide outpatient treatment to those who cannot or will not engage in voluntary treatment, or that it can reduce hospitalization or involvement with the criminal justice system. Many studies have shown that evidence-based AOT is successful in all of the above. I hope that after 22 years of making the wrong decision on AOT, that the legislature will finally choose to pass this bill. Those that are severely mentally ill and are cycling between hospitals, jails, and homelessness deserve a program for which they are eligible and that works. Thank you.
All right, thank you, Ms. Edelman. We have been joined with Senator Katie Fry-Hester has joined us now. As I mentioned, we were just getting out of a voting session, Education, Health, and Environmental Affairs. We've gone around and introduced ourselves. Senator Hester, do you want to introduce yourself briefly?
Thank you very much, Mr. Chair. Senator Katie Fry-Hester, proud to represent District 9. I serve on the Education, Health, and Environmental Affairs Committee, and I also co-chair the Joint Committee on Cybersecurity, IT, and Biotechnology. And my apologies for being late.
All right, thank you, Senator Hester. Next on the list of speakers is Mr. Charles Schuster. with the Howard Soil Conservation District, here to speak on HB 873 and SB 268. Mr. Schuster, are you here?
Good evening.
Go ahead.
Good evening, Howard County delegation members. I am Charles Schuster, a supervisor on the Howard Soil Conservation District Board of Supervisors. I am providing this testimony on behalf of the Howard Soil Conservation District Board of Supervisors. As your Howard County conservation and agricultural constituents, we appreciate the opportunity to provide comments on this legislation, and we urge you to oppose Senate Bill 268 and House Bill 387. This bill proposes to move the pesticide regulations section from the Maryland Department of Agriculture, where it has resided for over 40 years, to the Maryland Department of Environment, which has no current involvement or understanding of pesticide use, oversight, or regulation. Having pesticide regulation housed at MDA makes sense for a number of programmatic, fiscal, efficiency, scientific, logical, and economic perspectives. The agricultural industry is one of the largest consumers of pesticides in the state, and the products are critical tools for our nursery growers, landscape professionals, table food producers, as well as the farmers that grow corn, wheat, and soybeans, among other crops. Our farmers, landscape professionals, nursery owners, and other agricultural industry representatives work incredibly hard for the citizens of the state every day. Through MDA, any user of pesticides other than a homeowner is required to be trained, tested, licensed, and receive recertification on a very regular basis. The working environment of the pesticide section of MDA has been one to ensure appropriate education of those that use these products, as well as to maintain oversight of the recertification process. The regulations the agriculture community works with has federal government oversight through the EPA and USDA. Moving pesticide regulations from MDA, which has at least understands the appropriate use of pesticides by this industry, to MDE, where they have little understanding of the process developed as part of the federal pesticide regulations, would be considered a step backwards. This change could cause a negative impact on all small businesses and nursery operations. This would be because of delays in nursery inspections and pesticide inspections. The financial costs to comply could be significant. I would like to thank the Howard County delegation members for not signing up for this legislation. Many of you and your staff attended the Fall Farm and Conservation Tour, where we discussed how important the appropriate use of pesticides are to controlling insects, disease, threats, and promote soil health, and to protect our production system. Remember that appropriate pesticide use is also good for the Chesapeake Bay. Although MDA and MDE oppose this bill, little justification for the need for this move has been provided. As your constituents in the agricultural community in Howard County that would be negatively impacted by this legislation, we urge you to oppose this bill and focus your efforts to improve and protect the opportunities for the farmers that grow our food. Thank you.
Thank you, Mr. Schuster. As Senator Hester pointed out, the Senate Bill 268 has actually been withdrawn and was voted favorably, but out of the committee. So it is no longer under consideration in the Senate. That was just done in our prior voting session.
Okay, thank you very much.
Thank you. Next, we have Dr. Charles Richardson here to talk about assisted outpatient treatment for persons with severe mental illness. I see Dr. Richardson, go ahead.
Thank you. I'm Charles Richardson, a lifelong or 32-year resident of Howard County. I recently retired from the state of Maryland and Spring Grove Hospital, where I worked as a psychiatrist for 32 years. My experience there made it clear that the criminalization of mental illness remains a major problem in Maryland. The statutory authorization of evidence-based assisted outpatient treatment, or AOT, as Ms. Edelman spoke earlier about, as proposed in House Bill 1017 and Senate Bill 807, would go far to reverse this trend. The truth is that over 100,000 Maryland residents are afflicted by severe mental illnesses, including schizophrenia and bipolar disorder. Acute episodes of these brain-based illnesses require weeks to months of sustained medication before gradually resolving. This is far longer than typical inpatient admissions, which seek only to resolve acute dangerousness. Most patients voluntarily continue their treatment as outpatients as their symptoms continue to resolve. But a small percentage of patients will not cooperate, will not adhere to treatment, specifically because they lack the capacity to perceive the presence of an illness or the need for treatment. This perceptual deficit is a symptom of their brain disorder, which usually resolves at the same slow pace as their other symptoms. Maryland's mental health system does not currently provide a mechanism to ensure continued outpatient treatment for these types of patients until such time as they can again see the wisdom of voluntary participation in outpatient services. This deficiency in our system of care contributes directly to the criminalization of mental illness, as the disorganized and terrified behavior of inadequately treated patients all too often leads to arrests. Patients are then literally punished for their illness-driven behavior by prolonged incarcerations in jails and state hospitals. And the legal entanglements often lengthen their court-ordered inpatient treatment well beyond clinical need, reducing the efficiency of limited state resources. Tragically, in Maryland today, the only way to ensure sustained treatment of severe mental illness is for the patient to be arrested, jailed, and court-ordered for treatment at a state facility. This is just plain cruel. Assisted outpatient treatment is an evidence-based means of intensifying treatment for severe mental illness for those who are unable to recognize their need for treatment. It would address the need for sustained treatment so often necessary for a patient to achieve improved judgment, not merely the absence of dangerousness. It would do so without requiring the state or the patient to reside in a locked facility. It would make families feel more secure in allowing their loved ones to reside at home. It would reassure the local police that troublesome behavior is being addressed in such a way as to ensure community safety. It would provide a mechanism for civil court-mandated treatment while reducing the use of the more punitive and costly criminal court-ordered treatment. So I'm respectfully asking the delegation to support House Bill 1017 and Senate Bill 807 to institute this life-altering treatment. Thank you.
All right, thank you, Dr. Richardson. Next, we have Ms. Evelyn Burton with the Schizophrenia and Psychosis Action Alliance, here to speak about SB 807, Assisted Outpatient Commitment.
Thank you. Good evening, Chairman Lamb and Chairwoman Watson and members of the delegation. My name is Evelyn Burton, and I am the volunteer Maryland Advocacy Chair for Schizophrenia and Psychosis Action Alliance. We're a grassroots nonprofit organization advocating for individuals with severe mental illness and their families. I'm also testifying as an individual with a relative with serious mental illness who has lived in Howard County for over 15 years. And I'm here to testify in support of HB 1017 and SB 807 Assisted Outpatient Treatment Pilot Program. And even though this pilot program will not be in Howard County unless you can convince the Howard County government to request that they be added to it, it will show the immense benefits that other jurisdictions around the country have seen from AOT, so that then hopefully Howard County and Maryland could do their own program. Assisted outpatient treatment applies to a small subset of individuals with severe mental illness, and it's a collaborative system. It's not punitive at all. The court and the mental health system work together to assist the individual to engage in treatment and ensure that the mental health system is attentive to their needs. It's certainly less restrictive than involuntary hospitalization or incarceration. And I think Dr. Richardson spoke to the types of patients who need this. They're often caught in a cycle, an endless years and years cycle of repeat hospitalizations, homelessness, incarcerations at tremendous cost and stress on the many government systems and private systems. So there is misconceptions also often about this program. It is not forced treatment. There is no forced treatment involved. There can be no contempt of court orders. It basically works on what's called the black robe effect, where when an individual goes before a judge in a court, they respect that and follow the order because it's ordered by a judge. And so it allows them to stabilize in the community. It saves tremendous amount of money. In New York City, which you studied it extensively, it's required in the whole state there. Net cost per person declined 43% in the first year, and even greater savings after that, and not just the city, but all the areas of the state. Last year, my relative had 10 hospitalizations and over 22 ER visits, most of them at the Howard County Hospital. His medical bills were over $100,000, and I can't imagine what the costs were for the county in terms of other services. He became homeless and unable to care for himself. It's really hard to imagine how severe, how severe the disability from serious mental illness can become. Civil rights become meaningless because his speech became incoherent, his thoughts totally irrational. An AOT program could have stabilized him after release from the hospital much, much sooner. AOT is very effective. Its studies have shown 77% fewer experienced hospitalizations, 83% fewer experienced arrests.
Ms. Burton?
Yes.
Would you mind wrapping up in a sentence or two? I'm sorry, your time has expired. Thank you.
Okay, I'm sorry. All right. I'll just say that in conclusion, I really urge you to look at the testimony of Mary Ann Eckenberger, a nurse living in District 13, and also Melissa Mulroney, who's in District 13, who knew people that suffered for, up to 20 years in and out of hospitals and everything else before they were stabilized. And AOT could definitely shorten that and give them a good life to live. Thank you.
Next, we have Ms. Liz Fainer, who is signed up to speak about climate, environment, and zero waste. Ms. Fainer, are you there?
Yes, thank you.
Go ahead.
I'm Liz Fainer, District 13, and I'm testifying for several climate and zero waste bills. I'm a member of HOCO Climate Action and the chair of the Green Team at Emmanuel United Methodist Church in Laurel, but I'm testifying as a concerned activist about the climate emergency facing all of us. The Climate Solutions Now Act and companion bills are high priority bills, and I encourage you to please vote for them. And I thank those who are co-sponsors. I will be listing bill numbers in my written testimony. The Climate Solutions Now Act is part of a broader Maryland Climate Action Platform, which embeds equity and justice into every step. And I encourage you to act on the bills in the overall platform as well. In addition to the bills covered by the Climate Action Platform, I wish to speak on the Maryland Climate Equity Act. This act addresses the injustice that currently occurs because state agencies are not required to consider certain impacts their decisions will have on communities. Maryland state agencies that approve locations for power plants, highways, industrial facilities, and waste incinerators often disproportionately impact communities of color and underserved, low-income, and environmental justice communities. This bill is needed now to ensure that Maryland state agencies meaningfully assess a proposed project's potential climate change impact and the effect on these communities, workers, and jobs. And in order to meet our climate goals of reducing greenhouse gas emissions in Maryland, we need to have a truly renewable portfolio standard. Maryland's current RPS considers burning trash, burning chicken manure, burning wood, and producing methane all as renewable energy. Maryland ratepayers contribute over $32 million to subsidize these dirty energy sources in 2019 alone, over $200 million since 2008 through renewable energy credits. These dirty energy sources are overwhelmingly located outside of Maryland, meaning that Maryland ratepayers' money is flowing out of the state. Maryland cannot afford another year of throwing our renewable energy money away on polluters. So please support the Reclaim Renewable Energy Bill. And finally, we need to address our recycling and pollution crisis. I was prepared to speak on the Plastic Reduction Act, but disappointingly it failed. But I do thank Delegate Watson for supporting it. and I wish to speak about the Extended Producer Responsibility Bill, as responsibility for disposal of all single-use plastic packaging garbage should be extended to the producers and not left to the taxpayers. So please support this bill and I was going to say entire suite of zero waste bills, but the rest of the zero waste bills before you. Thank you for your time.
All right, thank you, Ms. Fainer. Last witness that we have for tonight's hearing is Ms. Ruth White, who's here to speak about the climate crisis.
Yes, hello. I'm Ruth Alice White. I'm speaking for Howard County Climate Action, a local 350 group, an international organization. You know, we are in a time of climate crisis where many parts of our state are barely above sea level and experiencing continual flooding. We don't have to wait to see the flooding that the Center for Environmental Science at University of Maryland says could occur up to 1.5 feet by 2050 or up to 3 feet by 2100. We know now that extreme weather events are affecting us, and they're caused by greenhouse gases emissions, which we must lower. 2 bills I'm talking about will address this crisis. And there are many, many more in the climate platform. But the first is SB 525 HB 88, the energy distribution planning to enhance our PSC process to upgrade our grid. We need the electrification that other bills are planning for, and we need no limits on the electrification. Right now, there are limits on how many solar projects can be in an area, limits that affect both commercial and even homes. And we need to assure that we can get power from offshore wind in the sea to the middle of our state. This bill will assure a large table of stakeholders are involved in planning and will maximize potential federal resources. This is related to our major bill of the year, the Climate Solutions Now Act, SB 528. And again, I want to thank those who are sponsoring this. There are corresponding House bills. These bills set a stretch goal for meeting greenhouse gas reductions for the state. However, in order to meet that stretch goal, we must look at the major causes of greenhouse gases, which are the fossil fuels we use in transportation and buildings, and move to electrify everything. These are the major causes of greenhouse gases. And the Climate Solutions Act addresses as requiring a zero emission state fleet and planning for a transition fund for zero emission school buses. Most importantly, it also addresses buildings, something that we haven't addressed as a state before, and reflects the very strong recommendations from the Maryland Climate Commission's Buildings Transition Report, so that under this bill, new buildings, just new buildings, both Maryland government buildings and—
Pardon me, Ms. White,
yes.
Would you mind wrapping up your testimony, please? Your time has expired. Thank you.
Well, private sector buildings will have electric heating by 2023. We urge your support to decarbonize both our transportation and our building sectors. Thank you.
All right, thanks, Ms. White. You are the last person signed up to testify tonight, so that should wrap up our hearing for this evening on statewide issues with the Howard County delegation.
Mr. Chair.
Yeah, go ahead.
Could you just make sure that the 2 people that weren't here earlier are not here now? And that would be Francis Yui and Chow Wu.
Mr. Yui or Mr. Wu with us? It does not look like
I don't
that's
see them in
case.
the
Okay.
participant.
Just wanted to be sure.
All right. So to the members of the delegation, please stay tuned for our next meeting, which will be another work session on Wednesday morning. You'll receive more information on the exact timing and what's on the agenda for Wednesday. Chairperson Watson, anything else you would like to add before we adjourn?
No, thank you all for attending tonight. We appreciate your input, and we always are here individually if you want to reach out to provide input on any matter. Thanks.
I'd also like to thank Ms. Rubeling for her work in organizing this, as well as our delegation administrator. A lot of work went into making this happen. We appreciate that.
Thank you, Abby.
With that, looks like we are adjourned. Delegation members, have a good evening.